hello, please introduce yourself and your business.
Yes, so I'm Dr. Duate Adegbite, and my business is Imana Health Inc. So we are a women's health supplement brand. We have our first product, an oral probiotic for recurrent yeast infections and immune health support. But yeah, that's pretty much me.
Fantastic, Duarte. So, what inspired you to start your business?
Absolutely. So I'm a family doctor and I have a special interest in women's sexual health and reproductive health. And I've worked for the last 10 years in a sexual health clinic where we've had, over the years, so many patients come in specifically asking for a probiotic option to help with preventing yeast infections, preventing bacterial vaginosis, like different things they can take for vaginal health specifically. And I didn't really have great options to give them. So I'd often just say some general probiotic brands because it might help, but they weren't specifically for what those people were looking for. And then I started thinking about it. I'm like, why isn't there a more easily accessible Canadian made product for what these patients are asking for? And started looking at the literature, got my best friend on board, who's also a family doctor. I'm like, let's do this. We got a manufacturer. And then we just created the product that people were asking for. And then we also combined vitamin D, which is what differentiates us from other products because we know no one in Canada has enough vitamin D. We're not in Nigeria, we're not in the Caribbean, we're too far from the equator, right? So we added vitamin D because also vitamin D deficiency has actually been linked to recurrent yeast infections in Black women. So it's really important for us to make sure that this is like a culturally focused product that obviously anyone can use, but we're really looking out for our Canadian sisters, Canadian women, because you need your vitamin D. You're probably not getting enough. But also this single strain probiotic that has really good evidence for preventing yeast infections. So that was what the inspiration was. It came from our patients literally asking for this product.
That is amazing. A product by Canadians for Canadian women. I love it.
Exactly.
I love it. And something you said just piqued my interest. You said you called your best friend on board, and how
Mhm.
has going along this journey with somebody of a like mind helped you along the journey?
Absolutely. So, my best friend, she's someone who I met on the first day of medical school in Toronto. Our eyes locked at orientation. I'm like another Black person, like the end. We were two of four Black people out of like 220. So it was easy to spot her. She's a tall Black woman, but we just had an instant connection. We have been best friends since then. That was 2009. And she is easily one of my biggest supporters. So when I told her about this idea and I was very passionate about it, she was like, any way that I can help, I'm on board. And I think it really speaks to our friendship because this has been a very time intensive and expensive venture to get started. So imagine having a friend who didn't necessarily have her own, entrepreneurial dreams, but was so excited to help me and come on board, try something different outside of medicine specifically, and just do this together. I think that is just testament to what an amazing friend she is, because I don't know how many friends would have taken on such a large project just to support their friend, but also, try something a bit different. And it was also in the pandemic, getting a bit burnt out. Family medicine is, prone to burnout. So I think it was just a nice way for us to spend time together doing something where we're kind of using a different part of our brains, right? Like I've been able to be much more creative and I used to be very creative, but in medicine, there isn't as much opportunity for creativity. So designing the packaging, designing the website, like that's really been just amazing to go on this journey with her and just have her as such a huge support. So I'm very grateful for my best friend, Dr. Nina Watson.
Oh, that is so wonderful. That is so wonderful. Thank you for sharing that. I think that a lot of times we want to do things by ourselves. I'm learning from you now that you don't necessarily have to. If you have somebody who's like-minded, who's your friend, your partner, I think it always is nice. They say if you want to go farther, you go with somebody else. So
Yes,
that
go
is
together.
amazing. Thank you for sharing. Thank you for sharing that.
My pleasure.
Were there some challenges you experienced when you first started?
I think that the journey of entrepreneurship is riddled with many challenges, like challenges upon challenges, right? So neither of us and our COO, Denai Munyati as well, she's on our team. none of us have business backgrounds. We're all healthcare professionals. So I think just the challenge of starting a business, right? Learning how to figure out we need to be incorporated. Well, what's the difference between a corporation versus partnership? So I think one big challenge was just acquiring information. I do think we're lucky that we live in this time when you can look things up online, but
Hmm.
getting that information, also finding mentors. Um, we haven't had, I think a challenge has been finding mentors kind of in the same space
Hmm.
or kind of adjacent, right? Like it could be just a product based business. We don't need a mentor who's specifically selling probiotics,
Yeah.
and ideally like a woman of color. So I think finding mentors has been a bit of a challenge, like figuring out how to break into retail and just things like that. It's a lot of just figuring things out as you go. And I think the Canadian market is different from American market in terms of there just being a bit more resources, more funding opportunities, especially for people of color, Black women. So it's been challenging. It's been very rewarding, and we've learned a lot. There's been a lot of mistakes made, but there are no failures, only lessons. So
Yeah.
we've a lot of things in hindsight. We could have done that differently, but we've learned from all the challenges that we've had, and it's been very rewarding. But lots of challenges, yes.
Okay. Okay. So, funding. I hear you say funding, for
Mhm.
example. There are not as many opportunities for funding here as there are in other places. So that will bring us to Face. How did you hear about
Mm.
Face?
I think in the beginning, so we incorporated in July 2022. So I believe either in 2022 or 2023, we were just searching, what funding is available, loans for Black entrepreneurs. And Face came up, and we're like, oh, that sounds interesting. But then we also were fortunate enough to be sponsored in a business mentorship program by the Black Health Professionals Network, so BHPN. And so we were part of their pilot program for business coaching. And so through that, we met Chris Alexander from Zoosh ZSE. And one of his biggest things was like, you need to get Face. You need to apply for Face yesterday. Why haven't you applied? Get it before you need it. Get Face. I'm like, do you work for Face? Like, why are you pushing Face so hard? So we'd heard about Face, but Chris was a huge push towards applying. So after our business coaching sessions with him, we did apply. Unfortunately, when we first applied, we weren't eligible because our product only launched, like our probiotic launched March 1st, 2024. And we applied to Face in 2023, thinking, it said you had to have a business that was like, functioning business, a business that was running. And we're like, well, we incorporated in July 2022, but we haven't actually been selling product yet. So we weren't eligible. We had to just wait until it was a few months after the product had been launched and we were making some sales, and then reapplied, and then have been very fortunate to secure funding that was recently dispersed. And we have a marketing intern on board, and we're just trying to make some waves. And I think it's going to be incredibly helpful in terms of furthering our journey.
So, what was that feeling when you first got, when the money landed in your account? What was that feeling that you had?
I mean, it's been a long, because again, we applied in the fall of 2023. So it has been a long time coming. We're like, praise Jesus. Like, thank you. Finally, we didn't think we were going to get it. We're like, it's been so long. I don't think this is actually going to happen. So for it to actually happen was an incredible, like indescribable moment. To get that email being like, you are approved. And I mean, our advisor, Wale, before we were officially approved, he was like, the last steps of BDC. But I'm like, is it, Wale, is it really, do we think it's really happening? Wale, because I've lost hope. So it was just amazing to have that support and get that funding. We already have good use for it. So it was at the right time, at the perfect time, and just, yeah, incredible. So amazing. We're so thankful.
That is amazing. I mean, now you already have
Mhm.
a marketing intern. I can't wait for the world, for the
Mhm.
whole world to hear about this product. So tell us about this product.
Mhm.
What is it? How can people use it? Where can we find
Mhm.
it? Yeah.
Absolutely. I want the whole world, especially Canadians, because we only sell in Canada right now, but we'll be expanding soon.
Eventually,
Yeah, so it's
yes.
the eventually, but yeah, from your lips to God's ears. So it's the Muna probiotic, and it's a probiotic that's taken by mouth. So some people are like, it's for vaginal health. Does it go in the vagina? It does not. Taken by mouth. There are some that there, but ours is in the mouth, and it's taken once daily. It has the best evidence for preventing yeast infections, especially in people who are prone to yeast infections. But the main ingredient, so it has one strain of probiotic, so it's called L plantarum, and then vitamin D. And that main ingredient, L plantarum, not only does it prevent yeast infections, it also helps to balance out the vaginal pH. So for people who are having issues just with like your discharge, I'm not sure what it is, we've actually had really good feedback from people who've tried it, and it kind of cleared things out. It kind of rebalanced things. But the actual evidence, there's been randomized controlled trials. It prevents recurrent yeast infections. And then vitamin D, like we said, that's there for immune support to prevent yeast infections in Black women, to give us the vitamin D that we need. Um, so right now, it's only available for sale on our website. So it's imanahealth.com. Right now, part of our face funding goals is to get into retail, trying to get into pharmacies. We're in talks with pharmacies and that kind of thing, just to make it a bit easier for people. We've been at a couple of markets as well, and we'll continue doing that as they come up. But imanahealth.com is the main place where it's available for purchase. And so far, only 5-star reviews. People are finding it. It's just so validating when you get such good feedback from people. Like we've even gotten emails. People are just like, oh, I would need to let you know. I don't feel comfortable posting publicly, but I wanted to make sure this is actually really working for me. And I'm so happy to have found it and also support a Canadian Black-owned business. But it's just been so gratifying to see how people are having an effect from this product. Because you have the research, you have the idea. Is it going to be as good as the research says? And then
Yeah.
it is. And that's just been it's so amazing.
That is amazing. Only 5-star reviews.
Mm,
Well, amazing.
yeah.
Amazing.
Yeah.
And the website to know is imanahealth.com. Do you want to
.com.
spell that?
Mm-hmm.
I mean, we'll put it on the screen,
Absolutely.
but so that
Yes,
everybody goes there, imanahealth.com.
exactly. So it's Imana. So kind of like the model Iman for people who
Okay.
remember her. I'm showing my age. Anyway, the model Iman with an A, health.com. So health.com.
Okay,
Yeah, and
fantastic.
Imana, the reason people have asked us before, like why that name. So
Yes.
Imana is the word for goddess in some of the East African languages. So Kenya, Rwanda, that's like Burundi, Rwanda.
Oh,
And none of us are East African. Like I'm Nigerian, Nina is Jamaican, Danai is Jamaican and Zimbabwean. But we kind of thought it was nice to have a word that's not necessarily from any country that we're from, to kind of just represent just the African diaspora in general, and not one of us has ownership over that name, but it means goddess. We are all goddesses. Our packaging is all purple, just pointing to royalty, luxury, like women as goddesses. So that's kind of the reasoning behind our branding and our name.
I love it. I love it so much. Thank you so much, Duarte, for sharing that. So, on a final note, I know somebody who might be watching is starting their own business or has just started or, is thinking about starting and if they feel like, I can do this. Can I really do this? What is a word of advice that you will have for them?
Absolutely. Sorry, I don't know if you can hear my dog barking in the background.
And it's like,
No, okay, perfect. Yeah, I think that the advice I would have would be just to do as much research as you can. Like I said earlier, I think that we're in a very fortunate time to start a business because there is so much information available online. There's so many books, there's podcasts, there's YouTube, YouTube University, frankly, extremely helpful. Um, and also just trying to see if you can find mentors. I think that Black women in our journey have been so willing and just really wanting to help us and support us in any way they can. People are giving up their time to meet with us, to give us advice, marketing professionals. And I think that it's just been so amazing how we've had support from people we don't know, just like,
mhm.
connections of connections. So I really would really encourage people who are interested in starting a business to reach out to connections you might have, reach out to people who might be in the same space or even adjacent spaces, use the resources available to you online. And at the end of the day, if it's financially feasible, like go for it. Try to prepare as much as you can. Try to, especially we have so many different incubators and accelerator programs as well. So see if you can join those for further information. But for us, I think a big part of the journey has been learning as we're doing it. We could have spent 10 years preparing and 15 years and then never actually start. But at some point, it's like getting started and learning as you go, but ideally preparing as much as you can. So that's the advice that I would give. Again, I'm a baby entrepreneur. So I'm still very much learning about entrepreneurship myself and still trying to do the question you're asking about. But that's kind of what I would say for someone who is interested in starting.
Thank you. Thank you so much for sharing that. I think that is, a lot of people say we are over mentored and we don't execute enough. I think what you're saying is don't just stay with training and training and training. You can learn as you go, but go.
Yeah. Yeah.
Thank you so much. This has been so much fun. Thank you so much for sharing.